Okay, Rachel, it is so wonderful to see you again and welcome to the Healthcare Rule Breaker Studio. So, we're going to kind of jump right in and we'd love for you to just tell us about you, about your foundation, your program that you're working on. Give us the details.
Yeah, absolutely. Thank you guys for having me. I'm so excited to be here. So I am Rachell Dumas. I'm a registered nurse, have been in healthcare for over 10 years and a nurse since 2016. So I started Alight After 9 after a very, very traumatic pregnancy experience. So starting in 2018, I had my first pregnancy, I had a miscarriage. The doctor said I'd go on to have pretty much a seamless pregnancy experience, which was not my experience. Starting in 2020, I actually started planning with my husband to have a baby. And then I was pregnant with twins, lost the first one early on, and doing a gender reveal, the second one literally just fell in the toilet. I had multiple losses since then, early losses, 6 weeks, 7 weeks. I saw quite a few specialists from reproductive geneticists to reproductive endocrinologists, maternal fetal specialists. I was diagnosed with cervical insufficiency, which basically means that my cervix was too weak to bear the weight of a child after a certain amount of time, typically going into that second trimester. The cure for it is called a cerclage, which is a suture around the cervix, and it is supposed to keep the cervix closed so the baby will stay in. Well, I had that surgery once I reached a second trimester in my sixth or seventh pregnancy. That cerclage failed. I was told to go and just deliver the baby, and I decided to fight. So I had all my friends look up a doctor, and I found one in Dallas. We flew down there the same day, and he performed what's called transabdominal cerclage, which is higher than a vaginal cerclage, to try and save a 20-week pregnancy. Surgery went well. Everyone was cheering when I woke up out of anesthesia. And unfortunately, at the anesthesia wore off, I started to have contractions. I was in labor for 30 hours straight, and no tocolytic could stop it. After 30 hours, my water broke, and I went back to the OR and got both cerclages removed, and I had to deliver that baby, which he did not survive, obviously at 20 weeks. I had multiple miscarriages after that, but that doctor promised me that if that baby didn't survive, he would bring me back to Dallas and we would do the surgery outside of pregnancy. And true to his word, that November, he flew me back and did it. May 2022, I found out I was pregnant. I took all my hormones. I made it to the second trimester, made it to the third trimester, and I finally gave birth to a beautiful baby boy at 36 weeks and 7 days on 12/30/2022. So, because of that experience, and yes, it ended wonderfully, but it was very traumatic. I decided to create Alight After 9, which is a nonprofit organization to help other women and families who are going through these issues, to have the proper resources that I didn't have and that I had to research. And we also are advocating to start care at the bedside to transform what maternal care looks like by adding palliative care.
I love that story. Thank you for your courage to share it, first of all, because I know you're not alone and that's a very hard experience.
Very.
But beautiful way to do something meaningful with all the tragedy.
Yeah, thank you so much.
Yes.
I'm very thinking through it.
Yeah. I was gonna say, I'm just the courage that you have to come on here and talk about that and be so vulnerable. It's I think we had talked before we decided to do the podcast, and just having that can be healing in itself. Sometimes people don't really recognize how hard it is to withstand loss, and then how
Yeah.
hard it is to be pregnant after a loss.
Yes.
And I think that's where, I see, I thought a lot about our conversation just after I first met you. And I was like, man, when I was going through that myself, just hearing someone that had a success story after that loss would have been, really meaningful, because it takes a
Right.
lot of courage to go back and try to start a family again after you've had
Right.
that experience. So, I'd welcome the opportunity to really hear about maybe what resources that you are putting together, or where what things you've seen that have been really impactful for the people that you're supporting?
Yeah, absolutely. So definitely mental health resources have been major for those undergoing fertility treatment and also sustaining loss and trying to get pregnant in after loss. If I could start the process over, and hindsight is 2020, right? I would have started counseling for my pregnancy journey before my pregnancy journey. Because even if you have a healthy pregnancy journey, it's just a lot on the body and a lot on the mind. But especially at the loss, I wish I had started therapy. And I even tried hypnotherapy in the midst of all the loss, just to help me continue on with that journey because I really wanted my baby. So we offer mental health resources. We're applying for grants to pay for those resources so that moms don't have to come out of pocket and our birthers don't have to come out of pocket for those resources because the pregnancy journey and the fertility journey is expensive enough. So we're also offering grant resources from other companies as well, and just a resource hub just to consolidate all these resources. We also find specialists for our birthers because it took me a while to find the doctor in Dallas, and luckily he agreed to do that. But I had a community of people out here researching for me. Everybody doesn't have that type of village. So I want to make this process as seamless as possible by allowing those who are giving birth and their family members to come to us and just say, this is where we're at. And we're like, well, you need this, this, and this. And here are the resources. You don't have to look any further. We are doing the work for you.
I think that's so impactful just in itself, just to feel like you can be unburdened
Yeah.
all of the things that are happening around you.
Yes. Y- Because when you're going through that, it's a burden in itself, right?
Yeah.
Burden of having to find resources that you need.
I don't have any personal experience with loss, but I do have some experience working in labor and delivery, which I barely claim. But you're a nurse. And so even having all of that background, such a struggle to figure out how to maneuver that. And I'm thinking, I love what you're doing for the community. So I'd love to hear for the patients and the people that are experiencing that. But I'm also really intrigued by what you're talking about with palliative care. So now I'm talking from well over a decade ago that I've last worked in labor and delivery or working with these women. And it's such grief.
Right.
And you may be right beside the room that has a happy, healthy baby and all the joy and all the laughter, but also being the nurse that's in there helping go through this process. And we did some beautiful things. There was some photography for memory making, and there was the university I go to does something called Precious Prints, where they give the moms, print fingerprints of the baby,
Yeah.
post delivery. There's some beautiful things happening, but nothing, at least when I was present, around out of care aspect. And how do you care for these women and care for the nurse too? So I'm curious if that's a part of it. And then what would I do if I were working and I'm like, hey, I know this lady is doing this thing, but how do I reach out? How do I find you and do all that?
Absolutely. So during my pregnancy journey, there were many times, especially when the pandemic first started, where I was in an emergency room by myself because of visitation policies, because of COVID-19, or in the room by myself, or literally passing a baby essentially around. And I'm in the hospital, but nurses don't have, an hour to stay in the hospital. Doctors don't have an hour. I mean, not in the hospital, but nurses don't have an hour to stay in the patient's room. Doctors don't have that. So we do need to rethink how we approach maternal health, especially during periods of loss and grief. And there's chaplains there, but they don't have the knowledge base to advocate for maternal health needs. We have palliative care, but I'm finding by talking to a lot of hospitals and different maternal health associations and organizations that they don't have the expertise in maternal health. So we need to create a new specialty essentially for palliative care and maternal health. So what I'm doing is trying to investigate in the hospital at the bedside, but also become an employer benefit because I also suffered at home. And a lot of us have miscarriages at home. we have to go into the hospital later, but a lot of times we don't. If they're early, we just pass them like a period. And often I was like, what's next? I am a trauma nurse. I'm an informatics nurse. I am not a maternal health nurse, when I was going through that process. So I didn't have that knowledge base to even advocate for myself because I didn't have the education or the experience. So, and a lot of people who are pregnant and going through losses also don't have that experience. So we need that hand holding at the bedside and thereafter.
Well, and I think it's really powerful to hear you say that you didn't have the knowledge base because we said, 3 clinical providers
Right.
and we think we don't have the knowledge base. Can you imagine someone who's navigating that and walking that with with their lack of knowledge of clinical care?
Right. Right. I think it's so important to note that nurses don't know how to do everything. I think that's like a common misconception for those outside of the healthcare field looking in that you're a nurse. You should have known that, you're a nurse. You know what a psychologist. You should have not sustained that many pregnancies. You should have advocated for yourself. But I don't have that knowledge base either. You know, I didn't even learn that in maternal health and nursing school what a psychologist was. I couldn't have advocated for myself if I tried, other than doing the research. So it is very important for us to be transparent in that way, so other people know it's not that simple, even for us. So I know you're going through it worse.
Yeah.
So, Rochelle, we do have like one question that we ask everyone who comes on the Rule Breakers podcast. And I want to say, like, when I first was looking you up and hearing your story, I thought, what a rule breaker to talk about palliative care and maternal health, right?
Yeah.
Like, I know we talk about this podcast in a very fun, lighthearted way, but very, very courageous of you to come on here and share your story and share it with the world and really, share how people can get resources and normalize this conversation. Cause I think that's the one thing that we haven't done well in maternal medicine is that we haven't normalized that people experience loss, people experience grief, and it's not all joyous, though we do oftentimes get our happy ending. Can you share like one thing if you were gonna break any rule in healthcare, what would that rule be for you?
That's a great question. I will break the rule and the stigma of how we view birthers. We, as birthers, are expected to one, give birth, not experience loss during that time, and to want to have children. I want to change that stigma. But also another thing is that I want to, like I said, change the way maternal health during loss, during fertility treatment, after loss, and trying again is approached. We truly, truly need palliative care and across with maternal care. And we need to create that specialty. And we need to put it in the hospital and have it acceptable to patients and really, really hone in on that type of innovation so we could decrease maternal death rates, decrease fetal death, and make a real change in maternal health.
It's so powerful and it's such a hot topic. It has been, but it's been more heavily on the radar lately. And
Yeah.
I just am hoping you get so much momentum and make such an impact for so many people because I'm with you. This is a necessary thing to do for our communities.
Yeah. We have too many unnecessary losses.
I agree. If someone was looking for you and they were wanting to talk to you, they were wanting to hear more about your the foundation, if they were wanting to get services from you, how did they find you? How do people get in contact with you? What's the connection look like for you?
Absolutely. Until we get into the hospital and become an employer benefit, you can definitely go to alightafter9.org. You can go to our Instagram, Alight After 9, our TikTok, Dumas, RDUMASRN. And you can DM us, call us, email us anytime, and we'll be here to help. We love doing mentorships for families going through this issue and to be a support in any way.
I love that. Thank you so much for sharing your story, but mostly for the meaningful work that you're doing and
Thank you.
just the impact that you can make.
I appreciate you guys for having me. It's been a pleasure.
Thank you for your courage.
Thank you so much. Thank you.